Hey, Dr. Tim Uselton here with Trinity Integrated Medical. And I just want to take a few moments to teach you about the various types of disc injuries that we see here in the office and the ways that we can help. The first thing is that when people say they have a slipped disc or they've been diagnosed with a slipped disc, that's kind of a lazy diagnosis because the discs never actually slip. That would indicate that they're in some slippery place and they slip out from under you like slipping on a banana peel. And that's not the way it works. The discs are actually connected to the bones on either side, and this is a model of a disc in the center here, the red portion, and then the vertebrae on the top and bottom. This is the body of the vertebrae, and this back here are the posterior elements, or the facet joints and the spinous processes and the transverse processes. Also, you'll see if you look right down towards the middle, right here is the spinal cord and the spinal nerve roots as they exit out. So what happens in a disc injury is, I'll show you on this side, I think it looks better. When this compresses, then the disc on the inside gives a little bit of a bulge. You see that? So it's normal. The nerve has plenty of space to do its thing. This is just some thread on the model, but this nerve right here, when it gets squished or compressed, now it's pinched. And that sticking out right there, that little bubble, that is a disc herniation. And what really is happening, if you took that same model and you looked down inside it, now you're kind of looking at the cross section of that disc, and you see that the outer part that's white in this model is called the annulus fibrosus, and the inner part is called the nucleus pulposa. Now, why is that important? Well, there are two different types of material. This is a very gel-like substance, and this is a very hard, very rigid, more cartilage-like. It's not quite cartilage, but it's got a property that's more dense. And so it's kind of like if you think about a jelly donut, something that we're all familiar with. A jelly donut, on the outside is the donut part, but in the very center, with coverings all around it, you have the jelly. And if you squeezed that jelly donut hard enough, then that jelly would squirt out, just like that. Now, when it squirts out like that and stays, then it's going to put pressure on this nerve, and that's why people have a pain or numbness or tingling that shoots down their leg when it's in their low back. Sometimes it can shoot down into your hand when it's in your neck. So we have these discs between nearly all the vertebrae in our spine, not quite all of them. You don't have any in the very, very tip top of your neck, in the atlas and axis, but all the other vertebrae have a disc between them, and any of them can herniate. It's harder to herniate, bulge, or rupture a disc in your mid-back because you have the rib cage that comes in and acts like a little separator, a spacer, to keep those vertebrae from squishing. But in the neck and low back, this compression happens, and it can put that pressure directly on to the nerve roots there. So I hope this helps kind of explain the different types of disc injuries. You've got bulges, which are pushing that outer part out. You've got herniations, where the inside is actually squirting through, and you can see the inside. And then you've got something that's very, very significant, and that's called a sequestration. And just like if you think about sequestering a horse, you're removing it from the rest of the horses. Well, a sequestered disc is when material on the inside has squirted out, and then it's detached, and that little gel part is free to float around inside the spinal column, because the spinal column has plenty of space and a small cord going through it, and so that sequestered segment can actually move up or down in the spinal, cerebral spinal fluid that surrounds the cord. So I hope this answers some questions, see about the anatomy of the disc and the disc injuries. And in another video, I'll show you exactly what we do to treat those types of injuries, because it can be fixed without surgery. You don't necessarily have to go under the knife. When you go under the knife, they start taking this material out. They start putting plates and screws in so that you have no motion at that joint, and that just leads to other problems above and below that area. So I'm here to tell you that there are treatments and we offer them here, and I'm gonna explain those in the next video. So I hope you had a great day, and I hope you learned something today listening to this video. Thanks so much.